Welcome, everyone. Thank you for joining us today. I'm Ebonee Williams, Director of Virtual Experience and Peer Engagement Initiatives for Student Affairs, and I will be your moderator this evening. I would like to read the following land acknowledgement to begin our time together this evening. The UC San Diego community holds great respect for the land and the original people of the area where our campus is located. The university was built on the unceded territory of the Kumeyaay Nation. Today, the Kumeyaay people continue to maintain their political sovereignty and cultural traditions as vital members of San Diego community. We are honored to share this space with them, and we thank them for their stewardship of the Mat Kumeyaay, which we also call La Jolla, California. For this town hall, we will have a group of panelists who are here to answer your questions about Return to Learn program. We will attempt to answer questions, and please feel free to submit your questions using the Q&A feature on Zoom. Due to our limitations, we will not be able to answer all your questions today, but we will log the questions as they come and post answers on the Return to Learn website, which is returntolearn.ucsd.edu. But first, I would like to welcome Chancellor Pradeep Khosla for opening remarks.
Thank you, Dr. Williams. Welcome, everyone, and thank you for being here. I'd like to spend our time together by giving you a brief recap of the core elements of our innovative Return to Learn program and emphasize why it is so important. We developed the Return to Learn program to enable a safe return to campus for students, faculty, and staff. And we've been working on it for more than 2 months now, more like 3 months. It's a cutting-edge combination of best practices in epidemiology, public health, and technology. It brings together the best ideas from a cross-functional team of leading experts in these fields, several of whom you will hear from in just a few moments. It also represents the expertise of our health system and campus leaders. And equally importantly, it represents the critical input from a broad constituency of UC San Diego faculty, staff, undergraduate, and graduate students. There are 3 pillars that are guiding the Return to Learn approach, and these are risk mitigation, viral detection, and intervention. As important as these 3 pillars are, there's an additional and critically important factor that will also contribute to the success of our campus repopulation this fall. And that factor is each of you. As UC San Diego students, you are uniquely bonded by the guiding principles of our university, a community united in purpose and integrity. It is this sense of unity that will drive measurable results for our return to campus this fall. Simply put, our success as a campus community will be driven by our choices as individuals. UC San Diego has always been an environment that drives big ideas and bold innovation. We were the first to announce our commitment to bringing students back to a safe learning and research environment and developed a plan to do so, and this was back in May. So I'm confident that as thoughtful and socially responsible members of our Triton community, all of us can unite in the shared purpose of protecting and preserving the dynamic and unique on-campus experience that is UC San Diego. So I'm looking forward to welcoming you back to campus, and more importantly, I'm looking forward to hearing from my colleagues, our experts, and our leaders of this campus. Thank you, Dr. Williams. Back to you.
Thank you so much, Pradeep. What great words, and what a great place to be with us all working together. To provide a quick run through for our webinar and the flow, I'd like to welcome our host for this town hall, the Vice Chancellor of Student Affairs, Alysson Satterlund.
Thanks, Ebonee. So first, my thanks to everyone for putting the town hall together, and to those of you who've joined us tonight. Thank you for your time. We know that all of you have been impacted in some way by the pandemic. This extremely difficult situation continues to require that we practice patience, flexibility, resilience, and continue to strive to put our community's health above all else. In addition, we know that it's been challenging for you all to make decisions with your loved ones about what is best for your particular circumstances this coming fall quarter. Tonight's Student Town Hall is part of a series of many efforts on our behalf to answer questions and provide you with up-to-date information so you are informed and empowered during this time and moving into the fall quarter. Our focus tonight is on the work we each will need to do in order to reduce the spread of COVID-19 on our campus and in the community. And before we move into the first part of our town hall, when I'll be interviewing some of my wonderful colleagues, I want to reiterate that we are guided by our goal to keep students, to keep you at the center of our work, to keep you engaged, supported, and healthy, and that we will continue to keep this commitment to you as we work through this very difficult time together. I also know that we're asking a lot of you. Masking, testing, symptom checking, limiting your socializing both on campus for those of you that reside with us and for those of you off campus as well. But we also intend to provide you with the support to position you for health and success, access to tools to monitor symptoms, free and easily accessible testing, telemedicine, remote access to academic well-being and social cultural support. And it's our job to remove barriers that would hinder you from access to these resources. So please make note of my email address, vcsa@ucsd.edu. If you come up against any barriers in accessing the resources that will help keep you and our community safe, please reach out to me. With that in mind, I'd like to go ahead and get started and introduce you to our Vice Chancellor of Research, Dr. Sandra Brown, the Vice Chancellor of Equity, Diversity, and Inclusion, Dr. Becky Pettit, and the Dean of the Graduate Division, Jim Antony. I have some questions. Shall I get started, Ebonee?
Yes, and I need all of your panelists to turn on their cameras and their microphones.
So Sandy, research was one of the first units to return to campus over the summer, our faculty, postdocs, and graduate students. What advice do you have for us to keep in mind as we welcome more students to campus later this month?
Thank you for that question. It's a great question because we've had a very successful launch of our research programs. And that has included faculty, it's included staff, and it's included postdoctoral fellows, graduate students, and even some undergraduates this summer also. I think that in advance, there are 3 things you can do. Number 1, every lab has a plan. And so you need to learn what that plan is. You get trained on that plan. And by screening and doing the appropriate testing, you're able to come in and work on site. Once you're on site, you're really in control of your own safety. And that's because we have very simple, clear rules to follow. Wash your hands or sanitize regularly, wear your mask, and stay 6 feet apart. Every lab has figured out a way to manage that combination and do their work in creative ways. So there's a lot of power that individuals have if they're planful and comply with the simple regulations that we have.
Thank you, Sandy. And that brings me to a question for Jim. So, Jim, as Sandy mentioned, we have had quite a number of our graduate students engaged in research on campus this summer. And we know that a number of our graduate students whose campus is home have continued to live with us since March. So what have we learned about our residential community from the graduate student perspective that can apply to also keeping our undergraduate student community a bit safer?
Thanks for the question. It's a great one. It's true. Our graduate and professional students who live on campus never moved out. Most of them stayed on campus and in their apartments throughout the entire summer, from March all the way through until the present. And we learned a great deal watching what really works well. Our graduate students really showed us what a safe campus residential experience could look like. They paid very close attention to social distancing, to masking, to following the guidelines that were set forth by the university and by housing, dining, and all of them did a great job. I sort of feel like as we're entering into the fall here, that's our exemplar. This is exactly what we imagine the rest of our students being able to do as well. Stepping up, knowing that for all of this to work and to work well, we all play a part, as Dr. Brown just said, in making sure that we pay attention to the guidelines the university has set forth, and realizing that if we do that, we'll have the same experience that the graduate and professional students had from March all the way until the present. They were able to be on campus, they were able to do their work, they were able to stay safe.
Thank you, Jim. I appreciate it. So one of the points of our conversation tonight, in addition to sharing with our students the resources that we have available to support prevention, risk mitigation, community impact, and compliance, is also thinking about the importance of abiding by and employing our principles of community, as we employ the compliance expectations. How can we, BC Pettit, Becky, this is for you, how can we keep our principles of community in mind as we approach risk mitigation and compliance expectations during a time of COVID-19?
Yes, thank you for that question. Our principles of community are as important now as they have always been. Thinking through how we are all trying to do our best to create the most ideal teaching, learning, and working environment, it's important that we all do our part, that we continue to be mindful of the respect and courtesy that we need to extend to each other. And there's one principle that I want to hold out. It is the one where we talk about each other's right to dignity, our obligation, our commitment to maintain a climate that is marked by mutual respect. So that's really important. And as a reminder, we had a few webinars and educational conversations about the need to reduce xenophobia on campus. I think that's important. First, we want to prevent it, right? Then if we see it happening, we are reporting that. And by being an active bystander, if you see something happening, and then reporting it so that we can take action on that. I also want to talk for a moment about the issue of face coverings and how that is both protective and also sometimes concerning for some communities, having to cover their faces that, with a mask that masks facial expressions, and how sometimes that makes particular populations seem more threatening, right? It causes Black individuals in particular to fear racial confrontations. So again, being mindful of our principles of community, knowing that all of our community members deserve respect, and to remember to extend the same kind of courtesy and grace and thoughtfulness that you would want as well, so as we try to keep each other safe.
Thank you, Becky. This is a question for Sandy. So Sandy, I know as a distinguished professor of psychology and psychiatric expertise at UC San Diego, you can draw from your own research conclusions and recommendations for how we might support our students in engaging in behaviors that reduce the spread of COVID-19 and keep themselves a bit safer. Can you talk to us a little bit about some of the research in this area and what we all need to be thinking about as we support many of our undergraduate students?
Thoughtful question, thank you. Undergraduates that are coming to us are learning how to be adults, and we model that. We model that through our communication, and we want to empower them to be adults. And what that means is we communicate that very message of community that we just heard Becky talk about so eloquently, that by my following the safety guidelines, I am keeping not only myself safe, but I'm making it safe for you. I'm making it possible for us to have the power to do things that if we don't work together, if we don't operate as a team, we wouldn't be able to. So I think the communication is really important, and to remember that it is possible for us to empower these wonderful young adults to be successful and they can be. And we're trying to create that kind of environment that allows them to be successful.
Thank you again, Sandy. So Jim, on a related note, this question is for you. So a number of our graduate students have continued to teach remotely, and some of our graduate students will be serving in their instructor capacity in person. How can we best support our graduate students, to particularly be successful in this role in person in the fall quarter, please?
Thanks for the question. So graduate students who are serving in an instructional capacity have a lot of supports through our teaching and learning commons, as well as through their departments, in helping them really think about how to structure their courses, whether they be offered in person or remote. And in fact, what we've learned since March is the importance of really increasing the level of support that we offer through the offices, and graduate students have taken advantage of those. All of the departments are really quite well equipped at this point in terms of thinking about how they're going to approach the fall. For graduate students themselves, some of them are going to actually be in-person courses that will be very small in terms of overall census or enrollment. And some of them will be taking remote courses themselves as well. The faculty are thinking long and hard and working really, really hard about how these courses will be delivered and what these experiences will be like. I also want to say that the university itself, particularly my office in the graduate division, has migrated much of its professional development and a lot of the activities that we typically do in person over to the remote format. And what we've seen in the last several months is they are used very, very well by graduate students. People are logging in and taking advantage of these professional development seminars, workshops. And our Graduate Student Association has also been incredible in terms of offering programming and a whole host of activities digitally offered that graduate students have found to be incredibly useful. So I think we're very, very well equipped. Your faculty advisors, graduate students know the importance of your experience and are ready to work with you.
Thank you, Jim. And this is a question for all three of you. What advice do you have for our students who will be returning to campus? We know we had about 5,400 students with us over the summer, with a majority of them being graduate students, and we'll be welcoming over a 10-day period an additional approximately 7,000 students. But what advice do the three of you have for students as they come back to campus and begin to navigate our campus in person? I'll start with Becky, and then Sandy, and then we'll wrap up with Jim.
My advice is really simple. It's also a request to communicate with us. Communicate your needs. We are doing our absolute best to try to anticipate your needs, to try to make this experience as enriching and as safe as possible. But we need to continue hearing from you so that we know what we're doing well, and we know where we may need to pivot to ensure that you're having a good experience. So please communicate with us.
Let me add to what Becky was saying about communication by saying we want you to not just communicate, but we want you to be creative. These are new times. These are great challenges. Nobody has the perfect solution, but you might have some good ideas. So the more you discuss, the more you talk in the communities that you're in, the more we will be able to find new ways to help people be successful. So I say communicate and be creative.
Thanks, Sandy. Thanks, Becky. Jim?
Yeah, I would echo what my colleagues were saying. I might add this. This university for the last 4, 5, 6 months has been engaged in very, very careful planning for this fall, for your arrival. It's guided by incredibly talented scientists and medical professionals and public health professionals and researchers, and everybody wants everything about this fall to be a success. We all want to get back to work. And you know, I think it's easy to look at what's happening at other universities and imagine that that's going to be a universal experience. But remember, every university has different contexts. Every university has different situations. And here at UC San Diego, we're very, very guided by safety, number one, by principles of science, and by a really, really strong plan that we actually have been executing for quite a while now, given that we've had students and researchers and faculty and health professionals working on our campus throughout this entire pandemic. So I hope you'll come here feeling a sense of confidence, feeling a sense of we've got this, and if we all work together and do what we need to do, we can make this a success. Is it going to be like it might have been, you know, if everything was normal? No, it's going to be different, but that doesn't mean it has to be bad. It can be actually incredible. And if we all step up to this experience and lean into it, I think we can have an amazing experience together.
Thank you, Jim and Sandy and Becky. And, you know, to echo that great point about working together and communicating with one another and exercising creativity and shared problem solving, I want to invite any of our students who are interested in offering ideas and being partners towards these shared goals. Please reach out to Associated Students, our Graduate Student Association. You can certainly reach out to the vcsa@ucsd.edu email address, and we can get you connected to many of our student organizations who are partners in leadership around these particular areas. It's also, again, a place where you can share feedback about things that aren't working, because again, we do not anticipate this to be a perfect quarter, but it will definitely be one that we'll be in together. And working towards supporting your health and well-being and your academic and sociocultural success. So thank you again to my panelists for letting me grill you with some questions, and I appreciate you offering your insights and expertise. And now I'd like to turn it back to Ebonee Williams for the next half of our town hall.
Thank you so much. That was an engaging conversation by such great experts that we have on our campus. Next we have, so thank you to each one of you. Next we have, we're moving to campus updates. So a lot of you are here to learn what's going on around COVID and coming back to campus. And we love the fact that at UC San Diego, we have the expertise of Dr. Angela Socia, our Interim Director of Student Health and Wellbeing Services, to bring us up to speed on the state of the pandemic and how we're planning to safely return to campus and our return to learn. Dr. Socia.
Hey, thanks, Ebonee. And so we're going to start out with a little view of California, which is very encouraging. You'll see that we did see this significant rise that occurred after Memorial Day and 4th of July. But then with some added restrictions and improved behaviors and awareness, we have seen a very nice and steady decline within California. So we're pleased with this progress. I think it really demonstrates that these behaviors, when they are practiced by a community, are extremely effective in slowing down this virus. This virus moves through people by the behaviors of individuals, and it will be through individual behaviors that we control the virus to a large extent. So let's then look at what's going on in San Diego. And here our picture looked really pretty good. We had that same rise in July, and then we saw a significant decrease. We do see a little bit of a blip in the last week or so, 2 weeks. And so we are watching this very carefully. We also know we just got through Labor Day. And historically, after our Memorial Day and 4th of July, we did see some upticks. We're hoping we will not see that. We are mindful of it, though. We are seeing just a small rise in San Diego. And one of the things that's important is we are monitoring the activity locally as well as within the state and the country every single day. So I just want to share that San Diego has seen a little bit of a blip, and we're on top of it. Next slide. So as the Chancellor mentioned, we have 3 core elements in this plan. Underlying it, of course, are our values. It's about safety and caring for each other, but it's risk mitigation, viral detection, and intervention. And then we're going to adapt. We constantly have to be paying attention to what's going on and making adjustments when they are needed. So I'm going to go into a little more detail on the next slide on some of the elements for reducing the actual presence of virus. Through the next slide, please. So some of these are the basic things that each of us can do as an individual. And that is that masking and face covering is incredibly important. And having both individuals, if it's a party of 2, or every individual, if it's a few more that are gathered, wearing masks is extremely effective. Distance also is very important. This virus is aerosolized, and the further you're away, the less chance that you are going to acquire viral particles or inhale them. So take advantage of the outdoors, make sure you are distancing, and the face masks are incredibly important. So keep that in mind. Also hand hygiene. The virus will be acquired when you touch your mouth, your eyes. Okay, so washing your hands a lot is really very important. Certainly before you eat, remember that every single time, and wipe down surfaces as well. There's some other things I want you to remember to do, which is be careful. In the past, you might share a drink with someone. You might share a particularly nice sandwich with someone. Don't share food or drinks. Don't share utensils. Be very mindful that these are ways in which virus is very easily transmitted. Also in physical distancing, be aware that we've made very careful to de-densify the campus. So classrooms, if they have students in person, will be separated by good distances. If you come into student health, you'll see markers so that you are also distanced as well. So throughout the campus, we've been very mindful to separate individuals through some guided signaling so that you don't get too close. Also, we've put a lot of extra hand sanitizer stations all around our buildings so that you have easy access to hand sanitizers and can wash your hands frequently. So some very important practices that will help us reduce the presence of a virus or acquiring virus on the campus. Next slide. So the next part is detecting the virus, and we have a number of strategies in here. One is the symptomatic testing. Anyone with symptoms, we want you to have access to testing. Same day testing, results back within 24 hours. We've even had individuals who are getting the results when they test in the morning, they have them in the evening before they go to bed. So there are multiple sites for testing throughout the San Diego area, as well as on campus at the Price Center. And for the month of September, we've actually opened an additional site, which is in one of the parking lots on the west side of campus off of Torrey Pines. We're using that for students right now who live off campus and any of those on campus, and they will be testing. We can test hundreds of students every single day, and that's working extremely well. That will switch during the period of September 19th through the 28th, and it will be a site for the undergraduates moving into campus. And I'll speak a little bit more about the undergraduate move-in process in a minute. So it's very important, all of the students, please make sure you've activated your My Student Chart, because this will be the vehicle that will allow you to self-schedule a test. It will also be the way that you will get your test results, and we're going to be communicating to you important health information. So please make sure you've activated your My Student Chart, and please open the app on your phone. Take advantage of it. It's a great tool. We're also working on looking for virus and environmental samples. Some of you may have known that we had an interesting event this Labor Day weekend. So we've been working on being able to sample waste streams. We know that this virus is said in feces with individuals who have acquired the virus, sometimes when they don't even have symptoms. And so by sampling the waste stream, you may pick up a trace of viral activity, or viral presence, excuse me. And so we actually had this happen to us. So an area that was draining the Revelle College area this Labor Day weekend on Friday, we found a signal of virus being present. So we sent a message out to our campus community, to individuals living in the residential buildings, as well as one of their science buildings in this area. And we were able to test over 600 people this weekend. And luckily, none of our students had any virus. So it's important to realize that this waste stream is another tool that we're using and will continue to use on our campus, and we're refining this process as well. And then the third arm is really looking for virus for individuals who don't have symptoms, but may be asymptomatically shedding virus. So by screening the community in various ways, at various times, we think we can pick up infections before they're there, or we may pick up individuals who actually have no symptoms but are shedding virus and are risking infecting someone else inadvertently. For our students, this has become a mandatory process. And why did we choose to make it mandatory for our students with the twice-a-month testing? It's because asymptomatic disease is much more common in young adults. We also have seen a higher positivity rate. So we really want to make sure our student community isn't accidentally shedding virus through no fault of their own. So by asymptomatic testing and screening, we have the ability to pick up and notify an individual they're shedding virus. And this will help them, and this will help their colleagues. So this is a very important process. We're asking our students to test twice a month, no sooner than 12 days apart and no more than 16 days apart. The other part we want to make sure is that if an individual does acquire this virus, we're taking care of them. For all of our students who happen to convert and acquire the virus, even if they're asymptomatic or they have symptoms that are mild or more significant, they will get daily medical check-in by the student health team, as well as mental health support from our CAPS team. We've created an ability to isolate students on campus with meal delivery as well. So it's important to know that we will continue to care for you throughout this. We also have case investigation and contact tracing. This allows us to identify anybody who may have been exposed, and exposed individuals may need to stay in their residential space and not move about on campus, and we'll provide support for those that are in quarantine, which is a little different than isolation. Isolation is for individuals who have acquired the virus. Quarantine is for individuals who've been exposed and are at risk for developing symptoms or shedding the virus and exposing others. And that occurs for about 14 days after there's been an exposure. So on the next slide, I want to go into a little bit more detail about our screening process. And this is something I hope every student has registered for your daily screening tool. This is extremely helpful. This will be your way to ticket to testing, because if you have symptoms, within a day, you'll be able to self-schedule that day and be tested and get your results. It's also, that's the red thumb, that you have some symptoms consistent with COVID-19. If you've been exposed or someone in your household has been diagnosed with COVID-19, you'll get a yellow thumb. That's exposure. That will provide you with a call and instructions about quarantine as well as testing. We don't test you immediately because it takes a while from exposure until shedding virus. So a yellow thumb is used will come up when there's been exposure to someone who may have who has COVID-19. The green thumb means you don't have any symptoms, you have no exposures, and you're good to go. So with this simple tool, every single day, our staff, faculty, and students are doing a check-in. And if they have a problem, we have immediate access for that testing. Again, that's such an important piece of this whole plan. So on the next slide, we're going to go into a little more detail for the undergraduate process. Why are we doing something a little different for the undergraduates? Because as Alysson mentioned, we have a large number of undergraduates coming to our campus all at once. It's a big change in our campus community. We're so excited about it. But realizing we are now going to bring on thousands of students all at once in a 10-day period, we felt we needed to put some very important safety precautions in place to reduce the risk of anybody inadvertently exposing multiple individuals or coming onto campus with virus. So this will be a process which is integrated into the undergraduate move-in. On the day you come in for your move-in, the first step will be a COVID-19 test. It'll be an anterior nary swab. You will then move on to moving into your dorm, your residential unit or apartment. That will be coordinated by housing and dining. You'll have a time slot, 45 minutes to unload all your belongings with 2 of your support individuals. You'll then be able to move around campus. And when this entire time, we'll ask you to be masked. We'll ask you to be masked as well as any family or support individuals who are traveling and coming onto campus with you. So everybody on campus will be masking. When you return back to your room, you will be asked to mask at all times in your residential unit, except when you are in your individual bedroom. Remember, everybody's in a single bedroom. And when you're in the shower, because of course you need to take your mask on there. And we'll ask you to maintain physical separation. Everybody moving in will be following these rules. After all the residents in the unit have moved in and a 12-day period has passed, which is this window of exposure, we're going to retest everybody. At that point, everybody should have had 2 negative tests. And we feel at that point we can move into another phase so that within your residential unit, you will not need to mask all the time. When you leave your residential unit, yes, you put your masks on. That becomes very important. But we wanted to create a space where we were pretty comfortable that every one of the students in the residential units had gone through this very careful testing, masking process. Now, if by chance, during that window when for phase 1, if you develop some symptoms, we'll repeat your test. Always when you have symptoms, immediately want to repeat a test. Similarly, we'll be doing some wasting management. So surveillance testing. If by chance something shows up in the wastewater, we may ask everybody to get another test, even though you were tested a few days before. We may say test again. We are really very fortunate that our scientific and health system community has created great access to testing. And through that testing, we believe that we will be able to identify virus very early and prevent significant outbreaks. So with that, I'm going to hand this over to my colleague in Housing and Dining. Ebonee, can you pass the baton to Jana?
Jana's already there. Thank you so much, Dr. Sosha, for the detail for both our undergraduate and graduate students. I just want to pre-warn you, we have a lot of questions coming to you when we get to Q&A around wastewater, and is it being is it happening at grad housing? What happens with isolation and quarantine? So with that, I'd love to invite Jana Severson, the Director of Housing Services, Housing Services, Housing and Dining, and Hospitality, to discuss fall repopulation and move-in procedures. Jana?
Thank you. Thank you, Dr. Sosha, and thank you, Ebonee. I appreciate that. I'm happy to be here to share some updates with you today for both undergraduate and graduate housing. In light of what we've been seeing in the media, I would like to start with a brief description of our housing facilities. I think that'll be helpful. So, at UC San Diego, we do not have traditional dorms like you might see in the image on your left there. That would be a series of many, many rooms on a long corridor and many students sharing a small common bathroom. We simply don't have any traditional dorms. What we do have are residential hall suites and apartments. In our undergraduate housing, we have both of those, res halls and apartments. In our graduate housing, it's 100% apartments. And I think it's important to share that for this fall, all rooms will be single occupancy. So where you might see in the drawing a double room, that is what it might be designed for, but only one student will be assigned to each of those spaces. So this greatly reduces our density on campus and the number of people that are sharing the bathroom. Next slide, please. So as Dr. Sosha has shared a little bit, the undergraduate move-in is going to be staggered over a 10-day period lasting from September 19th through the 28th. Students actually have already received their testing and move-in time. And I'd like to share, because we're getting some questions about that, it is a single time that you have signed up for, and those are complete now. It starts with your testing at the centralized testing site, and then you flow to your physical community where you actually be moving in. So we've had some folks asking if you need 2 times, you just need the 1 time. You start with testing, and then you go right over to where you're gonna move in. So as it was shared, during that process, students will undergo a SARS-CoV-2 test upon arrival, and it will be conducted in 2 stages. Again, after the initial test, the students living together in the residential units will wear their face coverings at all times, except for when they're alone in their bedroom or in the shower. And again, everyone will have their own bedroom. So after everyone has arrived, then we're in phase 2 of the testing process for undergraduates. And again, once a second negative result is received by everybody who's living in the suite or that apartment, then they're no longer required to wear their face covering inside. So that would be just like you and I at home with our families. When we're going out, we're wearing our face coverings. When we're home with our families, we no longer need to do so. It's important to share also that for both graduate and undergraduate housing, we will be implementing, or already have actually implemented, a no guest policy. The only exception to that is for caregivers. So it's important for everyone to understand we're doing that as part of the state guidelines relative to reducing density. So the folks that are inside our buildings are people who either live there or work there. And we really think that's going to help to be more successful and keep ourselves and our students safe. Also, just a quick share that during the move-in period, all of the dining from housing, dining, hospitality locations will be in a to-go model. Again, that's also to help with the reduction of density. Next slide, please. So the process for graduate and professional students is slightly different. As Dean Anthony mentioned earlier, we do have graduate and professional students living with us year-round, and they move in and move out throughout the year. So students that have been living with us, and as was noted, we were, around at least 3,000 early on in the process. Any of those students already had opportunities for testing, and any new students that are arriving or have arrived and will arrive after August 12th will also be receiving their SARS-CoV-2 test as part of the move-in process. The students will have 48 hours upon arriving to campus to take care of their test, and their results will be available usually within 24 to 36 hours through their My Student Chart, as Dr. Sosha referenced. That applies to both graduate and undergraduate students, as does the fact that the goal is to identify and isolate any asymptomatic individuals who could intentionally spread the virus. So graduate students will be asked to limit their interactions to their apartment, and they're asked to wear a face covering in their shared housing unit until they receive their test results. Now, a good chunk of our housing for graduate students is made up of studio units or one-bedroom units. And that is where then a student would be living by themselves. If that's the assignment that you have currently or for the fall, then you would not need to wear your mask inside. But if you do have an apartment mate, we would ask that you wear your mask until you receive your test results, which we very much hope will be negative. Next slide. However, should we receive a positive result, either during the moving process or throughout the academic year, we do have isolation housing that's available for our students. We have 300 beds available for asymptomatic quarantine and another 300 beds available for a symptomatic positive result. So currently we have students that are in our quarantine housing. Those are our international travelers that are with us for 2 weeks prior to moving to their assignment for the fall. But if needed, we could convert those 300 beds that are in quarantine over to isolation beds, which would give us a total of 600 beds to be able to accommodate students should they have a positive test. While students are in isolation housing, they do receive health and wellness checks, and meals will be provided. Students will have a chance to, a choice of either 2 or 3 meals per day. And there is no housing cost related to this. Meals will either be charged to your meal plan if you have one, or to your housing account if you don't have one. We're very excited about bringing students back to campus safely and look forward to seeing you here. And thank you for this time to share some updates with you.
Thank you so much, Jana. During registration, all attendees had an opportunity to submit questions for panelists to answer. We have selected some of the most popular questions for the panel today. If you have questions now, I'll remind you can enter them in the Q&A, as we've already been answering them, and some of them will reappear during this time. As a reminder, although we will not be able to answer all your questions today, we will do our best to answer your questions through FAQ posted on the Return to Learn website after this webinar. We will now welcome our panelists to turn on their cameras and join us for questions. We have a lot of them in queue, and we will do our best to answer your questions, even your questions about poo, but that is not where we're going to start today, okay? And I find that when I'm on a webinar, it's nice to know that there's about 170 of you who've joined us today. That number goes up and down, but you're not alone. So in the space of creating community, that's where we are. So I think that we get to start our first question. It's for Alysson, and if I know these people well, Angela will join in right after. What precautions are being taken to ensure UC San Diego doesn't end up with large cases like other universities across this country and possibly in this city?
So first, I think it's really important to recognize that all of our college and university partners across the country have been working exceptionally diligently to keep their students and community members safe. And the outcomes that we're seeing is not because people didn't have the best intentions and excellent plans in mind. So we've been learning a lot as well from our colleagues, and some of the things that have been going well, applying some of those, like stealing some great ideas like the Health Ambassador Program from the University of Miami and UC Davis. And then, also thinking about how can we learn from our colleagues where they have seen outbreaks that they had not intended. So much of that is what you've been hearing tonight, sharing the power of individual behaviors, making decisions that not only protect your health and well-being, but also protect the health and well-being of others, reiterating all the resources that are available to help you monitor your health, and then also being very clear, communicating expectations in that regard, and celebrating those of you that are honoring risk mitigation and prevention, and being reflective around community impact, and also being clear that for our students who are intentionally not complying with guidelines that support public health and well-being, being clear with you all that probation, suspension, and expulsion are certainly on the table as long as they are documented and the intentionality behind them has been flagrant. So just very clear in that regard, that's what I would offer. And I'm sure that other people who are part of our conversation tonight can offer what I've forgotten.
And I'd like to follow up. And this is a great example where we adapted our plan. A few weeks ago, our original plan was the undergraduates would come in with an initial test and then we'd be good to go. I think what we saw happen around the country gave us a moment of pause, and we put our heads together and we said, maybe this isn't tight enough. And that's where we adjusted our plan, and we said, we've really got to be mindful. Some of our students accidentally may have been exposed just before they came. They don't realize it. And we want to put in a second test. And that's where we went to, even though the first test is negative, until we're sure everybody's gone through an exposure window and had a second test, we don't want the individuals in their residential units to take the masks off. So this is another adaptation that we learned. I also think we have the benefit, unfortunately, of what other campuses saw go wrong, and our students are paying attention to this. And I think they are seeing that some very negative things can occur inadvertently very quickly, and that it is really only going to work if everyone buys into this, every single one of us. That is how we're going to make it through this pandemic and take care of all the people we love and all the folks we want to interact with and learn from and have great exchanges with. It is going to require all of us to do this. So our students have a little bit of the benefit of watching other colleges open. Some do it pretty well, some really struggle. And so I'm really very optimistic. So our students are paying attention to what's happening around and don't want to see their campus slow down or have to cut back in any which way. So starting a little later is actually going to work out to our advantage.
Thank you so much, both of you. We also had a question about why is our campus different? I just want to take a moment to reiterate, we have a medical school as a part of our campus. We have researchers who are about infectious disease as a part of our campus. We have the capacity to do testing within our own campus. And so all of those things lend to us being optimistic. And we've also had students on campus the whole time that people have been quarantined and since COVID has started and people were sent home in March. So those are all factors that keep us optimistic, separate from the collaboration you can see across the board based on answers and the collegiality and partnerships hopefully you've seen today. So the next question is actually for Angela and Alysson, but in opposite order this time. How is UC San Diego working to be transparent on tracking cases and maintaining safety protocols for on-campus residents? And Alysson, if Angela answers everything, feel free we can move on. So Angela?
So we have some public dashboards. You'll see we recently are starting to publish our dashboards. These will be updated every week. They show you how many people have been tested, both because of symptoms or asymptomatic screening, and they'll show you the number of positives. It's broken down by our student population, our campus employees, and our health system employees. So every week you're going to get an update, and we're making this visible to everybody. We're trying to also, through these town halls, through other webinars for other groups of students and other communities, we're trying to be there to answer questions. We're sharing everything. I think we want people to understand what we're doing. That was why when we had this wastewater sudden surprising result, because it had been negative before that. The minute we saw it on a Friday afternoon, it didn't matter that it was a 3-day weekend. We sprang into action, we opened up testing, we communicated with everybody. So we believe in being transparent and sharing what we're doing. I think that's our commitment to everyone.
Alysson, you want to add anything, or are you good? Excellent. Becky, I have a question for you. How can individual accountability or individuals be accountable in helping support students as we begin to repopulate the campus and consider creating inclusive, equitable community?
I will go back to what I said earlier about communication, communicating one's needs. And also as professionals, we do try to anticipate what our students and what our colleagues need. Understanding that everyone is unique. There's no one size fits all approach that we can take. Again, we do our best to try to create the ideal environment, but communicate, communicate, communicate. And we will ask questions about how we can continue to improve the learning experience for you. And as Vice Chancellor Brown also said, creativity is an important opportunity here. So if we don't have a structure in place, we may just not have thought of it yet, but we welcome new ideas as well.
Thank you so much. Such important information. Our next question is going to Jana. Will housing go back to double or triples in winter and spring? And I have an add-on to that, but I'll let you answer that part first.
Sure, all will be revealed, honestly. I wish I could be more predictive, but we have to see how things happen in the fall. We have to see what's happening in the county in San Diego and make our best decisions as we can moving forward with the situation.
Now, follow on to that question, which was asked tonight, was if we do go back to doubles, can I go back to hanging out and being with my friends, or am I just going to be randomly placed? Like, they want their community.
Yeah, that's a great question. What we won't know is what space will be available. So what we do know is we will provide priority to students who have a guarantee who canceled their fall contract. And we'll have to do assignments based on what space is available if we're allowed to fill doubles. But as we always do, we take into consideration requests from students if they have somebody that they'd like to live with or near, and we can assign them either into the same residential unit or into one very close by. We would absolutely take that into consideration. We'll make every attempt we can.
This is what happens when you click too many things. Sorry, be right with everyone. Thank you for that answer. The next question is going to a good buddy of mine, Ben White. I know you were waiting for me to come to you.
Hi, Ebonee. So excited to hear from you.
What are the key student conduct related policy changes student needs to know about for the state of the fall quarter?
Well, there's really four. And one is a standard of conduct that we're putting into our student conduct procedures to deal with enhanced safety requirements and guidelines. So your social distancing and the other things that we have developed over time. A key one Jana mentioned earlier is in the residential life community standards around the no guest policy and the caregivers exception. So that's a key one to know and understand. And then the nuances that Angela talked about testing and going through that process. There's also a campus face coverings policy. So that incorporates the county guidelines around face coverings. That's an important one to know. And then our COVID testing policy that was mentioned earlier too. So the required periodic testing. And the important part of that is the proof of compliance part of it. So you have to show that you have done that testing if you're asked by a university official. And if you can't show that, then that can be referred to our office for procedures under the student conduct code. So those are some key things to know and understand. And these changes are really geared toward the safety, health, and security of the campus community.
Thank you so much, Ben. It's so helpful. On that note, I'd like to go to our colleges. For all of you who know that UC San Diego has college system, Sherry Mallory is representing that beautiful system in the way we create community here and segment our large community we have. How can students count on the colleges for support this upcoming fall?
Yeah, so we definitely are here to support students. You'll still have access to advising staff through the virtual advising center, through advising appointments virtually if you need them. The student affairs staff are always here to support you. So if you're dealing with something, if you're sick, if you need someone to reach out to faculty for you, if you need academic accommodations, if you need help getting connected to campus resources, you can start with your Dean of Student Affairs. We also have Student Affairs Case Management. We have a team of folks on campus who support us, who can work with you. So whatever you need, don't hesitate to reach out and let us know.
Thank you. Must have turned off my video. All right, I'm having fun today with this technology. I figured I'd want to see if you guys were paying attention out there. The next question is going to Alysson and Sandy. How will off-campus incidents and large-scale social gatherings be addressed and resolved so that people do not get COVID? So hopefully encouraging some good behavior and talking about how we're going to address them.
Right, so this is a multifaceted response because it's a very complex question that doesn't have a simple answer. And I know people are desperate for just a simple answer. And we're talking about individual behavior and its collective impact on our neighborhood, our family members, our loved ones. So, I want to draw the point forward yet again that we started our conversation with, that, how incidents off campus might evolve is really in our individual control. Again, reiterating that off-campus behavior is reflective of our individual ability to mask and not socialize and not host parties. And I know that it definitely is restrictive, and it's not what any of us want to see, limiting your ability as students, as family members, as friends to come together. But we are in the midst of a pandemic that is quite challenging to manage without a lot of consistency around our personal behaviors. And we also have great confidence in our students. Again, we have thousands of students living with us this summer who've been very respectful of the neighborhood and again, using their creativity, using their voice, and taking responsibility to heart around these particular issues. And again, as I mentioned a few minutes ago, we have updated our student code of conduct to address issues, again, where we might see students intentionally bringing people together that have the potential to negatively impact others, so the spread of COVID-19, or the potential for that. We're working with our neighbors, and we have an off-campus work group that's also supporting compliance as well as resources, access to resources for our off-campus students.
The only thing I would add to what Alysson said is that we know that if some students or some individuals are not complying while they're off campus, and a student feels vulnerable because of it, that the campus is here to help that student. The kind of stress that COVID-19 is creating is a stress we've never faced before, not just as a campus, but as a nation. And one of the things I think we're really proud of at UC San Diego is that we are so student focused. So if you have concerns, if you are feeling stressed, if you're feeling anxious, if you're feeling depressed, we have resources here to be able to help you with that. And I'm really proud that our campus is this focused on students. We want it not only to be a safe place, but we want it to be a place that you can feel good, healthy, and happy at, so that you can learn well.
Well, I love that, happy. That's a great. I don't think that we have a good transition into my next question. It's the beginning of the end, but it's not. We have more questions to come, but I tried to avoid it as long as I could. But Pooh has resolved to come back to the forefront. Angela, I'm coming to you, okay? Will there be regular wastewater testing for graduate and family housing? And then which buildings will participate? And then I have a follow-on.
Sure. There's a lot of work going on right now because obviously having had this experience this last weekend, we're exploring getting more wastewater station testing sites up throughout the campus. They're actually in high demand. We're not the only campus or place to be doing this. And so if we could get, 250 waste testing stations deployed tomorrow, we'd be doing it. So we are trying to make sure we're covering the campus and then getting down to granular areas so that it can be a building, not a big wide area. So the waste plan is being explored and it will be expanded. We're also learning about the waste. We found out that the signal disappeared very quickly. We weren't sure how quickly it would disappear. We also know that feces can stay positive after a period when an individual is not infectious to others. So we have to think about when we have people who've recovered from this virus, then where do we not let them go back to other areas, which we have always done very safely because the waste may be positive. So knowing if we have recovered individuals who, while the virus may be in waste, they're not infectious. We have a lot to learn about this virus. And I'd like to take a moment to really emphasize this point. While young folks, young adults may feel somewhat buffered by this virus because the rate of symptomatic disease is lower, it is not universal. And it is not that if you are a healthy young adult, you don't have to worry about this virus, because actually some healthy young adults will get very severe disease. And we don't really know all the long-term complications. This virus, we are learning about it all the time. Some of our scientists are actually in that exploratory. They are some of the leading virologists in the world. This virus has not been on this planet very long. We do not know if there are implications 5 and 10 years down from being exposed to this virus. So we all need to be mindful and try and avoid acquiring the virus. We need to take care of the folks that have acquired the virus. So I don't want folks to be overly comfortable because you're a young, healthy adult. You're in a good space and you don't have to worry about this virus. You also don't know which of your friends might be immunocompromised, might have a medical condition, which of your faculty member, the housing and dining person who's so gracious and makes your meal for you every day. You don't want to accidentally expose someone else on campus. So we really do need everybody in on this. Thanks.
What a great answer. Thank you so much for taking time to make that point, because it's going to be essential to our success and we're only going to be successful together. With that, Jim, I have a question coming to you in the same vein of staying with grad housing. Will incoming graduate students be able to rotate safely, rotate labs safely? That's a huge part of their first year experience in traditional times.
Well, thanks for the question. And I'm going to invite my colleague, Dr. Sandy Brown, also chime in. There's a couple of things I want to say. As Dr. Brown already said, there are safety protocols that we've already been following for months now with the ramp up for research, and all PIs, frankly, all researchers on campus have clear instructions on how to involve research personnel, including students, in any research activity. In terms of rotations, sometimes are part of the programmatic structure in some of our academic programs. Each of those programs, those academic programs, has been thinking about how to do lab rotations. And I would encourage any graduate students who have a specific question about that to simply reach out to their graduate program coordinator to get the specific plans, because every program is going to do things slightly differently. Sandy, let me pitch it to you in case you have anything else to add.
Just a little bit, Jim. Thank you so much. We've already had almost 400 undergrads and over 1,600 graduate students working this summer in labs in a really safe way. Very, very few problems. So we've honed a lot of these challenges. And one of the really cool things, I think, is that the faculty who were going to have students rotate through their laboratories said, we need to plan now so that students will be able to do this in the fall. So on the website, Return to Learn, and the research part of it, you'll see that there's a very specific plan to help every laboratory lead, every research leader who needs to do training in their lab for people to come in and do rotations. Very specific instructions there for them to help them. We might not do things exactly the same way that we did before. In fact, I can guarantee you in many situations we're not able to, but we figured out ways for students to be able to learn how to use equipment, how to do new processes in labs, even in one-on-one training in a safe fashion, compliant with our overall safety goals. So that part, there might be some things we haven't thought of yet, but that part we did. So we're ready and looking forward to having students come back in the lab.
Thank you both. The next question is going to Alysson. Our students are fit, they want to work out, they're enthusiastic, they've seen other campuses have rec facilities that are outside. We live in San Diego, it's beautifully sunny. Not today, that has nothing to do with what my point is. It's a little gray today, but you know, you're not here, it's sunny, sure. Are we gonna have any facilities outside for our students to stay fit and lean this fall?
Absolutely. So we have some incredibly creative colleagues in our recreation department, and they're already working on outside yoga and a number of physically distanced activities that allow us to be together in community and be physically active as part of their programming efforts. So we're going to be taking advantage of all the positive that you've outlined, Ebonee, to get everybody physically active at this particular time.
Thank you so much. Alyson's muted again. I'm trying to get her to buy hula hoops for us, but I haven't been successful yet, you know, but I'm gonna look for a donor so we can all hula hoop. And that's how we'll know we're distant enough, far enough away from each other. And if you don't know what a hula hoop is, I don't want to talk about it because that means that we're of a different age. The next question is going to Sherry. Sherry, can you talk a little bit about what are going to be some of the opportunities for students to create community? The outline that Jana shared is when people are positive and have been together for a while, they can create these larger groups so that we've shared some of that interaction. What are some of the other ways that students will be able to create community?
Yeah, so we're still going to have all of the things that we normally have when students are on campus. We're just going to have them virtually for a little while. So we're going to have student clubs and organizations. We're going to have events and activities, opportunities to engage through our community centers. So, you know, we really have been working hard and thinking about this on campus this summer and throughout spring. We've been at this for a little while and have listened to our students and have learned from that. So we're going to try to create as many opportunities as possible for students to get involved, to connect, to find one another, and to feel a sense of community. And we have that commitment to do that for students that will be with us on campus, but also those that are going to be studying from other places in the state, across the country, and around the world.
Thank you so much. I think everyone here needs to know that behind the screen of all this, we have almost as many, if not more, staff supporting this programming. And one of our supports is AVC Patty Mahaffey. She's over student life. And I would be remiss to not mention the TWOW website, which has welcome events that you can get engaged with, our virtual student union that you can chime in and have that information and know that there's some other things for you to do. And the student orgs are being extremely creative in how they will be able to create community. And we encourage you to create a community of your own. And we're always looking for new platforms that may be exciting to you. So we've asked you to communicate. We welcome you to share those as well. So thank you for that. With that, I have gotten lost on what question. Oh, I know who I'm going to next. The famous Miss Angela. Everybody has a question for her because we all want to know we're going to be safe and live till we're 1,000,000 years old. What does a regular wellness check entail? What happens if it is found a student is not mentally well? Also, is there a chance for student isolation to exercise? I know that's a lot. I'll repeat anything you don't remember.
Sure. So let's start with isolation. Unfortunately, isolation is restrictive. Isolation is for individuals who are positive. And this is true for when people are in the community that are positive, our off-campus students that are positive, those on campus. You should be staying and confining yourself to what we call a sick room and a single bathroom if you can, or very careful cleaning, because you are infectious. That is the point. So we can do virtual yoga, we can do some virtual exercises, we can deliver a yoga mat to an isolation unit, a unit there, so we'll help the students do that. But we can't invite that student to leave the isolation space and move about campus. That would be irresponsible. So we're gonna work on virtual exercise and jumping jacks in the room. So there are things you can do there if you're feeling well enough. The other important thing is that this virus does make people feel often very fatigued. And so actually for our athletes and others, you can't immediately resume training after the virus. You actually have to go on a more slower pace. So we are very cognizant of the return to fitness and exercise after individuals have acquired this virus. It is one of the things we've learned about the virus we have to be very careful with. So that part of it. So that was the end of the question. Ebonee, give me the beginning again. That on that particular question, I'm remembering what the earlier part. Remember, isolation was at the end.
You're fine. You do not have to memorize. I didn't realize it was 3, or I wouldn't have done that to you.
That's
what does a regular wellness check entail? And
Sure.
it was talking about, and then the second part was mental wellness.
Absolutely. Thanks for the reminder. So one of the student health providers, either a nurse practitioner or a physician, will call you. How are you doing? How are your symptoms? If there's any concern about your symptoms, they may actually have you come over to student health and have an urgent care visit, maybe an x-ray or something else. And you do that, you come over mask, and you're allowed, we will figure out how to do that, right, in that setting. That is one of the times you can leave isolation, is very direct if you need medical attention. That would be one of the rare times you would leave. And so we've done that. We've occasionally had to have someone have some additional support medically. Occasionally we've dropped off medication. Someone needed some Tylenol. So it is a check-in with the healthcare provider. We can do video check-ins. We're doing that all the time for regular medical care right now in the time of COVID. So that's that. The CAPS team is always available. And the CAPS team has basically been doing virtual mental health support, counseling throughout the entire spring. And they really are doing an amazing job. There's almost as much CAP interface with students and individual counseling sessions going on now as when we were all live on campus. So they have switched to a video approach for the therapeutic support. If a student is really struggling and we're worried about their safety, then we would have to move them into a more protected environment. This is something that occasionally happens in pre-COVID time. So if there is worry about either harm to self or others, then we have to do something more active to make sure that student moves into a safer environment. And that may be off campus, that may be a different setting than where they are.
Adding on to that, I've got a lot of questions about, if I test positive, can I isolate at home, or do I have to go to isolation on campus?
Sure. No, you absolutely can isolate at home. So we've created that. We want to be in a setting where it is a safe home environment. In other words, somebody else is there as well, because what we know, we want to make sure that if you were to have any problems, you could get support and you could get extra care. So one of the things would you be going to an environment that you could be well supported in isolation? And if your family is close by and you want to do that, and that's great, we have no problem with that. We've occasionally, a graduate student, let's say, who has a partner and they have a graduate student and is living with a significant other in graduate housing, we would not force them to leave. We would allow them to stay in place because there are no other individuals than the family unit there. So we've occasionally made accommodations even on campus in a very unique setting for an individual to remain in isolation.
So in my mind, I have 2 more questions, but you gave such good details, we may not get to both. But one big question for students coming back in the fall, are we allowed to leave campus for the weekends to go home? What about Thanksgiving, or are they locked on here?
This is an important issue to think about. we're going to strongly recommend that if you choose to leave campus and visit your family or leave for other reasons, that you stay masked while you're away, because that is one of the most protective things you can do. Additionally, when you come back, we're going to ask you to do some extra testing. We think that's the safe thing to do. So we would ask you probably 4 days and 10 days after you've come back onto campus to get some extra testing done. That way, if inadvertently you've picked up the virus, you may be feeling great, but you're starting to shed virus, we're going to find out really early. So that's what we're hoping to do for students who want to leave or need to leave campus. That masking when you're away is so important.
Thank you so much. I'm going to lead into our last question, and it's for all of our panelists. But before I get there, I want to remind you to visit our websites, vcsa.ucsd.edu, Return to Learn, to get questions through FAQ. This is all sponsored by Return to Learn because we're excited about your returning to being able to learn in a safe environment in the fall. I know I'm cheating. I do this all the time. Some of you asked about the virtual, there's going to be a virtual club fair. So I'm answering a question. I don't have time to type it. And then you also can get support through Student Retention and Success, srs.ucsd.edu, which looks to support our students all year long. And they do it in a virtual environment. So I paused. But all of you, I'd love for you to answer. And if you don't want to, you're welcome to decline me. But, you know, I will be sad. What are you most looking forward to in the fall? And anyone can start.
Our students.
Yep,
We've missed you so much.
Students on campus.
I agree. It's going to be very exciting to have students back on campus.
Excellent. I'm assuming the head nods and the lack of unmuting means that everyone else agrees with students. So if you're still a student who is listening, know that we're so excited to have you come back. We're so excited to interact with you. Most of us signed up for these jobs to be able to be a part of your journey. And so that doesn't change in the virtual environment. So with that, I'd like to remind you to go to returntolearn.ucsd.edu. Which will include the recording of this event. Share it with others who are not able to attend tonight. If you friends had to leave early, tell them to come back and check it out. There was some great information that was given today. I'd like to thank all of our presenters. You were absolutely amazing and dealt with me, so I appreciate that, for sharing your time and information and talent and gifts today. Again, thank you to our guests. Thank you to our attendees. We appreciate you for spending time with us tonight as we get ready to come back to fall. Next, UC San Diego Executive Vice Chancellor of Academic and Senate Chair will be co-hosting the town hall for the faculty. So there's a faculty town hall coming up. And we plan to continue holding these town halls on a regular basis. So please visit returntolearn.ucsd.edu for more information. And if your question wasn't answered, we captured it. Go visit the FAQs and you will get what you need. And you don't know this, but I thank all our sub-panelists for answering over 40 questions. So thank you all. Have a great evening or morning, whatever time it is for you.